How to practice yoga with lower back pain. So, how to practice yoga if you have low back pain and maybe spondylolisthesis as well, which is where the disc has slid forward. And I'm going to give you some ideas, modifications, and options and tips for how to continue to practice yoga and heal the back. Remember, check with your physician. Having an MRI report will give you clear understanding as to what is actually going on, because some of the information that I'll convey will work for certain conditions and it might be a little different for others. So we'll keep that in mind, but let me just cover the basics that I have learned from my own journey with back pain as a yoga practitioner and a yoga teacher. My name is Todd McLaughlin, and here I want to just show you some of the things that I'm learning that I'm finding is working really well. So what we want to do, one of the things that blew and blows my mind is that initially when I started practicing yoga, I started thinking that it's all about bending into these deep asana, and that the deeper I could go into the poses, that would mean I'm perfecting my yoga practice. And with back pain, though, it's a different game. It's a different situation. And in actuality, what a lot of the science is pointing to is that back pain might actually require not moving the spine a lot. So that's one of the big factors we want to determine. Am I trying to bend my spinal column with the intent of improving my back pain? Because in some situations, we have tight muscle. And because of that tight muscle, stretching the musculature can feel really good. It can reduce back pain, and bending the spine will be really healthy and very beneficial. In some cases, when we have degenerative disc issues, where the disc space in between the vertebrae is a little bit messed up, for lack of a better term, then we want to be careful bending and squishing and pressing and pulling and doing all the different things, twisting the vertebra on that area where it's really sensitive. So this is where it's important to, I think, visit a doctor, get an MRI, and see what is actually going on. Now, everybody at our age, I'm age 52, everyone that's gone 30s, 40s, 50s, and older, 60s, 70s, 80s, we all have bulging discs. We all have a little bit of scoliosis, a little curve. There's something going on for everybody. It's normal. It's natural. It's not like something special happened to us. It's actually very common. But what I think is important is that when we start building spinal stability, because that's really what we're after when we have back pain, is we want to have a nice, strong, stable spine. If I just go for flexibility into a cat pose, which today feels really good because my back's doing really good right now because I've been doing some of these exercises within my yoga practice, we can go really deep into flexion, or in a back bending cow pose, we can go deep into the extension. But sometimes what's worth evaluating and experimenting with is doing very minimal to no movement with the spinal column. One of the directives that once I heard this, I started applying to my yoga practice was that, well, they have surgeries called lumbar fusions where they bolt you down so that then there is no potentiality for the vertebra to bend at all. And so what we can do is pretend that we had a fusion surgery, and we're going to use the muscles surrounding our spinal column as we want to strengthen them so there's less bendability. And I know that goes against everything you thought when you stepped onto a yoga mat, but that is important to know because we need to be able to bend our brains around these ideas so that we can actually truly heal. So now we have a set of movements in Ashtanga called the sun salutation. And right away, right off the bat, we come across a lot of spine bending movements. So one way that I like to practice sun salute when my back is flared up is I can still raise my arms above my head, but I'm going to get really technical already with you on this. Watch what happens when we do arm movement with the spine. Like right now, my spine is relatively there's a curve in it, but I'm relatively vertical. Usually what happens when you take your arms above your head is we go into a little bit of extension movement. Now, for a really healthy spine, wonderful. But if we're trying to avoid back bending, because the next question that is really important to figure out is that, does your back feel more aggravated when you go into flexion, or does your back feel more aggravated when you go into extension? And or does your back feel more aggravated when you go into rotation? You're going to start to decipher, and I want you to pay really close attention next time you practice any yoga, is start to feel, where does my back feel best, and in what positions does my back feel worse? And sometimes, just like the elimination diet, an elimination diet is where if I have a bunch of allergies, the idea is that I'm going to do a fast, go down to water, and then I'm going to add one food in per day. And then I'm going to see, well, how do I react when I add the new food in? Now, in a yoga diet, a yoga posture diet, what we can do is an elimination diet. You bring it down to one pose, and we could pick something like Samasthiti. Actually, one of the best poses that you can do if you want to pick one pose, if you have back pain, is lie down on the belly. Now, not everybody this is going to work for, so I just want you to know that. I can't give a one-size-fits-all instructions for you. It's going to require you to figure this out on your own. I'm just going to give you some ideas. Lying on the belly is a really, really good pose for helping to create spinal decompression and to alleviate some of the pain that happens from compression on the discs. Now, some of you might say, well, when I lay on my belly, that hurts, but when I lay on my back with my knees bent, that feels good. Well, then you might have figured something out specific to your spine. If it feels better here, another big one is that this one actually creates more of a lumbar curve, and that can actually create compression and a slight spinal extension, and that can actually make the back feel a little uncomfortable. But if you bend your knees, your lumbar kind of flexes a little bit, and therefore it might alleviate or kind of open very gently the space on the posterior spine. So you might find that laying on your back is the primo pose, and or you might find that laying on your belly is the best way to go. So that's going to be like a critical ground level starting 101. Let's start to figure out what is better. Do you feel better laying on your back? Do you feel better laying on your belly? Now, if you're in an inflamed state, it's going to take a little bit of time. We want to just figure out what is something you can do right now to solve your back pain. And we need to just pick one thing that gets you 1 degree out of inflammation and intense pain into, I think this feels a little bit better. That's all we got to figure out. Don't worry about, I want to be healed right away. It's a long journey. But we just got to figure out what alleviates it a little bit. So the first two things I want you to play with, I just mapped it out, is laying on your back with your knees bent, or is it laying on your belly, and to see which one feels like it gives you a tiny bit of relief. That might be where your yoga practice starts and ends today. Now we have maybe you've already been doing yoga for a really long time. And part of my whole idea with these tutorials of how to practice yoga with injury is that my wife and I, Tamara and I, have been running this studio here in Juno Beach for 20 years. And we have worked with a ton of thousands and thousands of people, literally in the last 20 years here, thousands of people working and learning about what poses work with what injuries through trial and error. I read a lot of books, but I've learned this through working with you, working with people. And so what I want to remind you is that we can figure this out. It's just going to take a little bit of time, so be very patient. Okay, so next up, a really classic scenario, and I already started to kind of point you down this track, is that here we can start to exercise spinal stability. And right now I have a relatively neutral spine. And what you do is you just start very slowly working with either flexion or extension. And again, you're testing. You're doing a lot of testing. This is a science experiment, a science project. You have a hypothesis and you're going to test it now. I do a back bend. How does my back feel here now? Let me try flexion. How does my back feel here now? Let me try neutrality. How does my back feel here now? and you start to feel which one feels like it's a little bit better. So that's one way to work. Now, when we start going into the sun salutation, I made mention that when you raise your arms above your head, instead of doing a big back bend and letting your arms go back, what you might need to do is put your spine on lockdown. I know it sounds a little weird, especially after COVID. Nobody likes that word anymore. But in a sense, lockdown meaning there's the ability for it to move. It's not a rigidity that causes you to like be super stiff, but it's that I'm going to move my arms without really moving my spinal column forward or back. What I'm doing is learning how to make movements with my limbs where I am not really compromising movement of the spine. And this is really important. You're going to just kind of stabilize the trunk. You're going to stabilize this part. You can even put a little bend in your knees. Sometimes, oh, there's so much to talk about. When you lock out your knees, typically what can happen, if you push your knees all the way back and you go into a locked out position, that sometimes puts us in what's called lumbar lordosis, where we have the hip sticking back and we have a back bend. So in that case, sometimes what's important is to strengthen the muscles on the front, and the muscles on the back are really tight. So what we're going to try to do is do a little bit of contraction of the abdominal muscles on the front to start to kind of pull the body out of that lumbar lordosis. And subtlety is key here. Subtlety, subtle movement, not extreme. Little tiny movements are really going to make a difference, I promise you. So what's happening here is that if I have a hard time, I lock out my knees and I feel like I'm in this lumbar lordosis. If I bend my knees, I might have a little more ability to move the pelvis and pull the belly in. So you might actually choose to start with a little bend of the knees. Now, the other big thing when you're managing back pain and learning how to practice yoga with a certain pain in the body is that we have to learn to adapt the poses to the situation and not adapt your body to, you have a problem. You're not just trying to copy a pose and make it look like the person on Instagram or YouTube. You want to do it like how your body needs it to be done. And that takes self-empowerment. And that's really a key to all of this, really. So what we're going to try to do is then when we raise our arms up, now to go forward, I might just come forward and bring my hands on my knees, and I'm going to keep my spine relatively neutral. If I go into flexion, the spine is like this, neutral. If I go to extension, the spine is like this, neutral. I'm going to try to stay neutral and see how far can I come down into my hip flexion while maintaining relative neutrality of the spinal column. So notice that for me, for us, for you to go down, and again, you're not going to be picking up anything heavy right now. You've heard a million times, don't pick something up with your back. You want to pick things up with your legs. So a big part of managing back pain is strengthening quadriceps femoris and gluteus maximus. I mean, hamstrings as well. I mean, everything we want to get nice and strong. But a big thing is we want to power up our legs. We want our legs to be strong enough to be able to let us be able to do bending movement without having to have to bend the spine. So in that respect, if I just go for a malasana where I have my toes turned out, because I've been working with my hips to stay flexible, I can come down and come up. The same thing. That way you're going to start to power up your legs. So doing really simple squat work, don't go real deep. Don't go to a high intensity interval training class to build your quads and hips when you have back pain. Do it on your own. Work with this video. Work with our online videos, all that sort of stuff, because you got to go slow in the privacy of your own home. So you're not trying to keep up with your neighbor. This is a really important thing to help strengthen your legs. Don't try to race. Now, the other element, you notice I'm imagining that I have a lumbar fusion, and I'm going to bend and do all my movements without compromising this. And what happens is we start learning how to strengthen the limbs so that we build stability in the spinal column. Now that we have these theories laid down, these ideas are, you have an idea now, you have something to work with. We just apply this theory to every single yoga pose. And so now I can just start going through a couple of different poses and showing you that theory in applied asana. Okay, so Surya Namaskar A. I have my spine on lockdown. I raise my arms above my head. I'm going to keep my spine nice and neutral. I'm going to do a gentle forward fold. I'm going to raise my head up. I'm going to come down onto my hands and knees. For the up dog, I'm not going to go all the way into an up dog and do a big old extension movement. I'm just going to do my up dog right here in a neutral spine. Okay, and then we have down dog. Now, it really depends on where you're at with your down dog ability, and this takes a lot of practice to learn how to do down dog and really engage your abdominal core and keep your spine relatively neutral. It is possible because down dog is really arms above the head. So you noticed already how I mentioned that when you go for the arms above your head, we're trying to do it where we're learning not to do a big extension. Now, I know people are going to teach you to do a down dog where you do a lot of spinal extension, but you're just not going to be able to do it like that for the time being. You got to let your teacher know, hey, look, I'm going through some back pain. I'm learning how to practice yoga, and I'm trying to do my yoga, but I also want to get my back to feel better, so I'm not going to be able to do the poses the way that you're talking about it in class. Now, if you have a teacher that gets mad at you for saying that, you got to find another teacher, honestly. If you have a teacher that says, I totally understand, I would like for you to do whatever you need to do and take as much time as you need doing it. That's the kind of teacher I think I want. That's the teacher I have. And that's the teacher I think is really important for you to listen to right now. Don't just do what people tell you to do with no real good reason for it. All right. So then we are going to come back to this halfway lifting. We're going to come back to a gentle fold without moving the spine too much. And we come up, we keep our spine relatively straight. We bring the arms up, and then we exhale and we bring the arms down. Now, another big one that's really popular in Ashtanga yoga, which used to be my favorite, but now no more, no mas, is the Urdhva Dhanurasana. Urdhva Dhanurasana is the classic back bend that there's a ton of energy put on. Now, again, I'm really kind of teaching to my own experience because for me, back bending is my trigger. Now, when you start about talking about forward bending, again, we still need to be very cautious. Personally, forward bending tends to feel good at a certain level, but then if I go super deep into the forward bend, it can get a little burny down in there. You can feel the nerves kind of getting squished on, and it's tolerable, but do I really want to do that? Is that really a good idea? If I'm trying to get to a place of zero pain or low pain, I want to get you want to get our pain threshold down so we can actually feel good. So one way to do this is that I'm going to take a strap. I'm just going to work on neutral spine. Spine is on lockdown. No bendy, no bendy. No more bendy. Don't think of it like bendy. Yoga is not about just bendy. Yoga is about taking good care of yourself so you can enjoy life and be productive and make good choices and learn and grow. So our pose can look like whatever it needs to look like for that to occur. So right now I'm accessing stretching my hamstrings without bending my spine. And I think bandha work is really important. You get all these debates by people saying bandhas, no bandhas. Bandhas, what are bandhas? Bandhas basically the use of your internal locking system or your internal muscular system. I think that's really critical when we're trying to lock down and not bend the spine a lot. If you use your rectus abdominis muscle and your transverse abdominis muscle, you can use that to kind of seal the internal contents in, so that now I'm going to isolate the movement just to my pelvis. I'm not going to do a really big flexion position in the spinal column. The spinal column is going to stay relatively neutral. And when I fold, I find that here's my edge. My pelvis is as far as it can go, where my back of my legs start to light up. And I'm just going to hold here and breathe and meditate on healing and focus and positive energy and start to visualize yourself healing. That's huge. You got to imagine you can actually get better. You have to think positive. It's absolutely critical. It's hard to do. It's the hardest thing in the world to do when the back is all flared up. All right, so another classic one in the Urdhva Dhanurasana, you probably saw on the thumbnail for this discussion that I was doing a bridge. What I was trying to point out with that bridge is that, well, here I'm going to take a strap, and I'm going to put a strap around my knees. I'm going to take a block. I'm going to put the block between my knees. I'm going to strap it down so that that doesn't go anywhere. It stays put. And I'm going to take a block between my feet, and I have the block between my feet like this. So I have a pretty even alignment. Block, feet on block, knees, block, strap around knees. All right, good. and then you're going to lay down on your back. Now, one of the things to work with here is the ability to contract the abdominal muscles. And notice that when I go up from my bridge, I'm not trying to push my pelvis up and have my spine go into a really deep back bend. What I'm going to try to do is pull my belly in and actually drop the ribs down so that this is relatively flat. Not a lot of curve, not a lot of bend. I'm going to just actively squeeze my knees into the block. I have the strap there to help. I can even do a little bit of in and out resistance where you try to separate your knees and you try to pull your knees together. So this way we start training the abductor and adductor muscles in the legs. And then also when we lift up, we can still contract our glute max muscles, but you're going to keep your spinal, the center part, nice and still. And if you hold and build strength in your legs and not really try to do a big curve in your spine, we can really start to generate stability and ability to brace and hold the back relatively still while the inflammation goes down. What happens is the inflammation goes down and you're able to get a little more bending in there, and it's not so bad. The other main thing I'd like to focus on, and then one day you have another bad day again, you lock it down. And then the inflammation goes down and you unlock it. That's how it is. You're opening and closing constantly. Now in a twist, actually a really good way for me to show you this, I think, is to use a block when we twist. So in this case, if I sit up on a block and I bring my one leg forward and I bend the knee, now I'm able to get my spine pretty straight here. The reason that sitting on the block is good is that here I'm in a little bit of flexion, and that might be too much. I know you're like, oh, are you kidding me? I have to be that alert and aware to my body? Yeah, the answer is yes, we do. Yes. Yeah. Simple answer. So now twisting. How do I twist without having a bunch of twists go through my lumbar spine? Well, you got to stay up really high and work the rotation just in your neck and your upper spine. Right now, this isn't moving. What's moving is a little bit of thoracic mobility, and I'm just doing really gentle twisting motion. Super gentle twisting motion. Keep the middle section nice and strong, nice and stable. The upper portion, do I look cool? No. Is this posture gonna like get me 1,000 likes on YouTube and Instagram? Probably not. Maybe me sharing this information with you and you have back pain, maybe it will, because you'll be like, oh heck yeah, man, this guy's speaking my language now. But is it popular? Not really, not yet. It's getting more popular though. The more people I work with, I'm realizing more and more people, they have pain and they want to practice yoga, but they're just trying to figure out how to practice yoga with pain, with injury. And here I'm just doing a really simple twist. Does that make sense? Am I being clear? Let me know. If you like what I'm saying, tell me, comment. If you don't like it, tell me, comment. I learned by you talking to me. Tell me what you think. It's okay. I have thick skin. I can handle it. All right. Thank you so much. Again, remember you can visit us at nativeyogacenter.com. I release a podcast every single Friday, Native Yoga Toddcast. Check out the new episode coming out every single Friday morning on our YouTube channel, Native Yoga. You can follow us on Instagram at Native Yoga, Facebook, X, all those great places, LinkedIn, whatever. Maybe you don't think they're so great, but we can use it as a sharing tool. That's all. I think that's about it. If you have any specific questions, people email me all the time from watching these videos, and I happily respond to you. Thank you so much, and have a great day. Namaste. Walia. So thank you, Walia. I just got a comment from my good friend Walia Walker Norton. Walia owns a yoga studio in Oklahoma, in Stillwater, Oklahoma. If you're anywhere in the Oklahoma area, check out Red Earth Yoga Center. Walia is an incredible yoga teacher. She's one of the best in the country. I highly recommend you going and checking her out. And if you have any friends or family in the Stillwater area, send them to Red Earth Yoga Center. She is amazing. Thanks, Walia, for chiming in. I really appreciate it. And I love you too. All right. Thanks.